Doctors told a Triad man he couldn't keep living in his condo because of health issues. He tried to get out of his lease, but the landlord wanted $10,000. A call to 2 Wants to Know's Kevin Kennedy made that hefty price tag disappear.
For David York, walking these days, even just a little, takes a lot of effort and involves as much pain.
Imagine sick, just a sick feeling just deep inside your hips.
A degenerative hip, the primary issue, heart problems not helping.
On my third pacemaker, I've had a heart condition since I was born.
Before moving here, David was living in a 2-story townhome.
I got to where the stairs with my hip, it got to where I just could not traverse the stairs any longer.
David had 8 months remaining on his lease. He spoke with the landlord.
When I told him it was a medical problem, they actually was like, we really don't care.
The landlord refusing to break the lease.
I actually showed the landlord of the complex. I showed her the x-rays of my hip.
It didn't matter.
Mr. David York is under medical care.
Doctors telling David and the landlord he shouldn't stay.
Make it difficult for him to get up and down stairs.
He left a couple weeks later, the landlord responding.
Threatening letters such as, you need to pay up or we're going to turn it over to a collection agency.
David told he'd have to pay $10,000 for breaking the lease.
I reached out to you, and I think a couple of calls from you sort of changed their minds about wanting to pursue it.
We spoke with the property manager, sent information about a disability and breaking a lease. Guess what happened?
They backed off.
The landlord dropping it, the collection agency closing the case.
I thank you so much. I see the things that you do for other people, and that's what made me call on you.
David still doesn't move around like he did, but there's no more stairs and no $10,000 problem. Kevin Kennedy, 2 Wants to Know.
Now, the state does have policies in place to protect people who have to break leases if it's because of a health issue.